Foot Phantom back. This time we'll be talking about a foot cyst. Here we go. Alright, there are various types of foot cysts. This is a ganglionic cyst. How do I know this? Well, an MRI was performed with and without contrast, which confirmed that it is a ganglionic cyst, which is a gel-like substance which is within just above the level of the skin and usually protrudes from a joint that's nearby. This is a setup which consists of a local anesthetic with a combination of lidocaine and marcaine, depomedrol with lidocaine, number 15 blade, 18 gauge needle, suture removal kit. All I need is the tenotomy scissors in this case, some ethyl chloride to give the shot, and some sterile gloves, and of course Hibiclens to prep the area. This patient presents with a 6-month history of a growing, painful cyst along the lateral aspect of the left foot. The patient states that this pain and discomfort was interfering with his activities of daily living. The patient's main complaint was pain along the lateral side of the foot with trying to apply any type of closed-toed shoe. The patient was offered to remove this surgically within the operating room suite, but due to COVID fears, the patient opted to have this performed in the office setting. There are various ways to remove this cyst. Aspiration with decompression, incision and drainage, and of course surgical excision. Here, a little wheel is placed with a mixture of local anesthetic with lidocaine and marcaine just along the area where a small incision will be made. Here a number 15 blade is utilized to make a small incision, approximately 2 millimeters. In regards to neurovascular structures in this area, there is a sural nerve that usually is just plantar or inferior, just below where the incision was made. So it is safe to proceed with minimal chances of neurovascular injury. This area is very taut, and I am attempting to pierce through the capsule of the ganglionic cyst to provide relief. Carefully, I feel the tension, and I know that I am very close. I do not want to make too big of an incision in order to assist with rapid healing. Here I utilize some tenotomy scissors out of a suture removal kit in order to break through the superficial aspect of the cyst. I can feel the tension exactly where the cyst is. At this point, I utilize number 15 blade once again to pierce through the superficial aspect of this cyst. There I feel the puncture of the ganglionic cyst. There you see some of the ganglionic cyst fluid. Now it's just a matter of decompressing it. Approximately 5 cc's of gelatinous fluid is expressed. And to be on the safe side for confirmation, this will be sent for pathological identification, which at this point was already confirmed to be a ganglion. Here is just a matter of decompression. You can feel some fluctuance, and I just isolate the fluctuance and apply mild pressure to decompress the ganglionic cyst. There you can see as I press on the sides, there's a small bulge, which indicates that there's additional fluid. At this point, I will use 3 fingers to finish decompressing it. Here's a little more, utilizing 2 fingers. and I just work my way around. Please don't forget to subscribe, like, and follow. Here is the view of the ganglionic cyst, cystic fluid. Like I mentioned, it's approximately 5 cc's. I still feel some gelatinous fluid and some fluctuance as I press down. Circumferentially around the incision. Here I will use the 3-finger technique that I mentioned earlier. As you can see, the extra fluid right through there. Additional ganglionic cystic material was removed. From the area until no fluctuance was noted and no tension was noted with compression along this cystic area. In order to prevent these kind of cysts from recurring, it's important to use an anti-inflammatory medication. Some people do this, some people do not. I use a mixture of a local anesthetic with a steroid. I use the surgical incision as the point to apply some anti-inflammatory medication. The important thing in recovery is to instruct the patient in regards to compression along this area in order to prevent the ganglionic fluid from recurring. Here I apply a Band-Aid and an ACE bandage in order to provide compression. The patient will also be provided with anti-inflammatory medications as well, depending on what the current medications that the patient is taking. Will limit some of the non-steroidal anti-inflammatory medications in order to provide anti-inflammatory effect and decrease the possibility of recurrence. The patient was instructed to apply ice, rest, compression, and elevation over the following 2 weeks and to limit strenuous physical activity. Here the ACE bandage is applied with mild to moderate tension. Of course, the patient was instructed if this feels too tight to loosen it, and of course if it's too loose to tighten it slightly. The patient will follow up in 2 weeks for evaluation. Thank you for watching. Please subscribe, like, and follow. Foot Phantom out. See you soon.